दोस्तों वेलकम to channel toxicology on board. Today in this video we'll be discussing another DABT topic, that is the acute carbyl poisoning pesticide toxicity. Let's directly dive into the question. This question was taken from ABT recertification examination May 12, 2000 paper. So the question is, a semi-consciousness pesticide sprayer is brought into emergency room from a nearby orchard with acute carbide poisoning. So in this particular incident case study, they're already telling that the type of poisoning is acute carbide poisoning that occurred within last 45 minutes. So the time of exposure is also given, that is nothing but 45 minutes. Is starting to have trouble breathing. So first symptom what we can see in this particular patient is that difficulty in breathing. In addition to putting him on mechanical respirator, so since he is having a difficulty in breathing, the patient was kept on mechanical respirator, cleansing his skin of any remaining pesticide residues. So in case of pesticide poisoning, the first another important thing apart from putting the patient onto mechanical respirator is that we need to wash off or remove the clothing whenever whatever the applicator is was wearing at the time of exposure, and wash off any unabsorbed pesticide which is remaining onto the skin. Which of the following treatment is indicated? So let's see what are the options. Option A is propranolol followed by intravenous anti-inflammatory steroid as needed. Option B is 2-PAM, that is pralidoxamine followed by atropine as needed. Option C is atropine as needed followed by 2-PAM. Option D is atropine only repeated as needed. Option B is Option E is supportive therapy only, possibly with theophylline to keep the airways open. So right answer will be in the green text, that is option C, atropine is needed followed by 2-PAM. As you can see in this figure, this is a atropine auto injector. That's why the number is given 1. 1 should be followed by 2. Second one is pralidoxamine oxide. Okay. Let us understand why option A is not right. Option A is propranolol followed by IV, intravenous anti-inflammatory. So we are giving propranolol followed by steroid. This particular combination of propranolol plus next to steroid, this approach might be used in specific situations. What are those situations? Thyroid storm, specific anti-inflammatory conditions, and perioperative care, but not in this case of acute carbamide poisoning. Second one is why option B is not right. 2-PAM followed by atropine. As I said, no, always atropine followed by 2-PAM. It should be there in the case of acute carbamate poisoning. Why let's see. Another explanation given in detail about option B is 2-PAM is an enzyme that is useful in organophosphate ester poisoning, but not carbamate ester poisoning. So we have to remember in this cholinesterase type, no, two type of pesticides will be there. One is organophosphate, second one is carbamates. Next we have option E. Option E is supportive therapy only, possibly with theophylline to keep the airways open. As I said, no, you have a difficulty in breathing, you can counter and you can mitigate this particular risk by using theophylline, a bronchodilator medication that works by relaxing the smooth muscle surrounding the airways to help keep them open, making it easier to breathe. Okay, but this particular thing is not used in the case to counteract the cholinesterase inhibition. Okay, so with this particular question, we'll also learn about other concepts related to this particular question. So we'll be, as I said, no, in case of anticholinesterases, two type of pesticides will be there. One is carbamate, second one is organophosphate esters. These are two main classes. Examples are Mipafox, DFP, that is diisopropyl fluorophosphate, TOTP, that is triorthotoluene phosphate. Then we have parathion, malathion, and leptophos. Always, it's a choice of topic for the examiner that they will be asking questions on parathion and malathion. What is the major difference between these two type of toxicity? You should be knowing target organ for parathion will be lung. That kind of questions they will be asking. Next important thing is the mechanism of both classes is the same. Either it is carbamate or organophosphate esters. What they will do, they will inhibit the enzyme anticholinesterase. So whenever this anticholinesterase enzyme is inhibited, acetylcholine levels in the synaptic cleft neuronal junction, NMJ junction, neuromuscular junction will be increased. As a result of what cholinesterase, whatever the symptoms will be there, no, that will be increased. So acetylcholine, what is the main mechanism of this acetylcholinesterase is that it will break down the neurotransmitter acetylcholine. Since this particular enzyme is inhibited, acetylcholine therefore accumulates in the cholinergic nerves. Okay, here you can clearly see that acetylcholine levels have been increased, because of which what symptoms you will have? You'll have salivation, excessive salivation, lacrimation, urination, and defecation. And for the exam point of view, you can remember it with the acronym SLUD. And in addition to these symptoms, we'll also have muscle fasciculation, tremors, tachycardia, and convulsions. That is the reason in the question case study we have seen tachycardia, increase in the heart rate. Next, coming to carbamates, unlike organophosphates, the major difference between carbamates and organophosphate esters is that these carbamates, they will produce irreversible inhibition of acetylcholinesterase. Okay, whereas organophosphate esters, they will cause irreversible type of inhibition of this acetylcholinesterase, something called aging, that we will see next slide. Carbamates are also rapidly biotransformed. So whatever the acute carbyl carbamates will, they undergo rapid biotransformation. Next, organophosphate esters, they react with serine in the case of acetylcholinesterase and often form irreversible complex. As I said, the whatever the complex which is formed, it is a it's like a covalent binding. Okay, irreversible complex will be formed. Carbamate esters are essentially just a poor substrate for acetylcholinesterase. So whenever there is a carbamate ester as well as a organophosphate esters, this organophosphate esters will have more selectivity. These are poor substrate for this particular enzyme acetylcholinesterase, and can be considered to form reversible inhibition. The difference is really in the rate of dephosphorylation or decarbamylation. So let's see what else we can learn from this concept. Some see, as you can see, this is the two pump is there. Okay, and here anionic site is there, acetylcholinesterase. This is the esteric site what we were talking about. Okay, then next is some anticholinesterase bind irreversible to the active site of acetylcholine, right? To produce aged enzyme. I told you the concept of aged enzyme. An extra charge may be fixed on the protein. Here you can see the charge which prevents dephosphorylation. This example TOTP, triorthotolyl phosphate, it will produces the so-called ginger jack paralysis or jack leg. What happened in the case in there was a Jamaican ginger extract through which alcohol used to be, that was the source, and this particular type of alcohol was contaminated with this TOTP, triorthotolyl phosphate, as a result of which the persons who were consuming this contaminated Jamaican ginger alcohol, they were getting this particular symptom called ginger jack paralysis or jack leg. And the main important symptoms what we have seen in this particular patients is that clumsy, shifting gait, etc. And next important point you have to remember is that the most sensitive species in order to test organophosphates pesticides is chicken and cat. It's not rat, rabbit, or dog. It is chicken as well as cat. Next, you have to remember in this particular thing is about a term called dying back or degeneration of axons, and their myelin sheath is common. Okay, here you can see in the pictorial there is a dying back of this degeneration of this axon. Okay, as well as this myelin sheath. It's a common for this carbamate type and organophosphate type of pesticide. For organophosphate ester poisoning, atropine is used to counteract the muscarinic effects. Right, it uses antidote, you can say, of the accumulating neurotransmitter. 2-PAM is an enzyme that is useful in organophosphate ester poisoning, but not carbamate ester poisoning. That is the reason in our question, the case study was about acute carbyl poisoning. In that case, 2-PAM alone cannot be used. Atropine followed by 2-PAM can be used, but but the 2-PAM as such cannot be used for this acute carbyl poisoning. 2-PAM reactivate acetylcholinesterase enzyme. 2-PAM speeds up this dephosphorylation rate. Our 2-PAM cannot reactivate an aged enzyme because it is an irreversible damage. Once the binding is done, it's like a covalent type of bonding, you can say. Okay, so hope from this video you were able to learn about the organophosphate esters, acute carbohyl poisoning, atropine, 2-PAM. Okay, malathion, parathion, some of the examples are there, and we also got introduced to the concept called ginger check paralysis, Jamaican alcohol extract contamination with TOTP. Okay, remember the acronym for cholinesterase poisoning whenever it is there, no? SLUDD. So they will definitely ask one question with respect to acetylcholine or adrenaline, non-adrenaline. This type of questions will be they will be asking. Pesticides is also another major topic with respect to exam. So always remember what are the classes of different pesticides are there and their type of toxicity or target organ. Okay. Thank you so much. Be curious for any questions. You can always write mail to arya.priyanka18@gmail.com. Like, subscribe, and follow my YouTube channel, Toxicology on Board. All the best for your exam.